This is Dr. Ramji Rajendran. I'm a radiation oncologist from the Alexian Brothers Cancer Institute in Elk Grove, Illinois. I'd like today to talk to you about brain tumors. Brain tumors are a group of abnormal cells that grow in or around the brain. They can destroy brain cells or cause indirect damage to cause swelling in the brain and increase the pressure within the skull. The image in this slide is an example of a magnetic resonance image, or MRI, and it shows a slice of the head looking from top to bottom at the level just above your ears. The gray oval at the edge shows the skull. The darker gray in the middle of the oval is the normal brain tissue, and the white circle within the normal brain is a brain tumor which has taken up MRI contrast material. Tumors can appear to be malignant or benign. Malignant tumors grow rapidly and often invade or crowd healthy normal brain. Benign tumors do not contain cancer cells and usually grow slowly. The two images show a malignant tumor at the top and a benign tumor on the bottom. The malignant tumor has areas that are not evenly white and do not take up contrast as evenly as the benign tumor, which absorbs contrast material in an even manner, causing it to appear white. There is also a black halo around the more malignant tumor, which corresponds to an area of swelling of normal brain from rapidly growing malignant tumors. This area of swelling is not in the MRI of the benign tumor. Brain tumors can also be primary, meaning they come from the brain, or metastatic, which means that cancer cells from elsewhere in the body break away and travel to the brain. Brain tumors can be classified from where the tumor is located, the type of tissue involved, and whether they're benign or malignant. Malignant tumors are examined under a microscope to determine how malignant they are. This is called grading of a tumor, from least to most malignant. Factors that determine the grade of a malignant tumor include how similar these tumors are to normal brain tissue, how fast the cells are growing, how many blood vessels are seen in the tumor, and the presence of dead cells in the middle of the tumor called necrosis. Here are examples of grade 1 through 4 brain tumors that a board-certified pathologist would be able to determine once a biopsy is obtained. The cause of primary brain tumors is unknown. Environmental and genetic factors may play a role, and prior exposure to therapeutic radiation as a child seems to be a contributing cause in very few patients. Symptoms of brain tumors include headaches, nausea, vomiting, seizures, behavioral changes, memory loss, vision or hearing problems. There are many different treatment options for patients with brain tumors. However, these depend on different criteria. It depends on the size and type of tumor, the growth rate of the tumor, and the general health of the patient. These treatment options generally include surgery, chemotherapy, and radiation therapy. Surgery includes the maximum safe resection of a tumor, and that's generally the first treatment recommendation to reduce pressure within the brain rapidly. Chemotherapy is sometimes used and is often used in aggressive brain tumors in adults with radiation therapy, and concurrent therapy has become the standard of care for primary brain malignant tumors. Radiation therapy is also used, and new techniques of delivering radiation that target the brain tumor while protecting nearby healthy tissues are often applied. Here is an example of gamma knife radiosurgery, in which a brain tumor is seen on treatment day on the left and is outlined in the yellow circle, and 6 months later, the image on the right shows the brain tumor has nearly disappeared. There are other techniques of radiation therapy that allow for excellent treatment of brain tumors. Please visit the following pages on radiologyinfo.org to learn more. Thank you for your time and attention.